All right, everybody, welcome again to another episode of Endotopic.
Endotopic, the cutting edge of surgical conversation.
Wow, surgical conversation. I like that.
Yes.
That's a good thing. Well, my name's Romi Mirza, and I'm president and owner of AM Surgical, and I'm here today with JP, of course, running the boards. Thank you very much.
Sorry, I don't have my camera up.
It's okay.
No, I was going to be in it.
Yeah, well, you know, you're special too. You're special.
Special.
You're a special guy.
No.
Really special guy. And we're here today with Aaron Celis from UNLV. He's a undergraduate student, and he's here to ask me some questions about my business and what I do in healthcare and everything that has to do with endotopics, I guess, right? Wouldn't that be a good thing?
Yep.
So, yeah, without any further ado, Aaron, shoot, tell us all about yourself.
All right. My name is Aaron Celis. I'm an undergrad student at UNLV. I'm studying business right now. For my final project in one of my classes, I was interested in discussing global health and germs with someone who's a little bit more qualified than my classroom of 20 students. I reached out to a couple of local healthcare professionals here in the Vegas metropolitan area, and they recommended I reach out to Mr. Romi Mirza, the owner of AM Surgical. He was nice enough to invite me onto the podcast Endotopic for me to ask him these questions, so here I am.
Yay. I love it.
Before we begin, I wanted to give a quick insight to UNLV School of Medicine. I'm not a med student, but the program is very highly accredited. The program is selective, competitive, but it produces quite accomplished doctors and fellows. Luckily, I'm not on track to go to med school, but I'm interested in medicine and now AM Surgical. Can we begin?
We can begin. Yeah, that's great. And, you know, it's interesting because a lot of times people are interested in medicine, but they don't want to be a doctor. And there are so many other things you can do within the realm of healthcare that the whole thing is so broad, right? You can be the guy cleaning and mopping the OR. You could be the person doing the pharmaceuticals. You could be a tech. So there's so many things that anyone your age can do in the medical field that is not being a doctor. And it all helps, and everybody's important. In that respect.
Yeah, it was pretty funny to learn that you're actually not a doctor, but you work with them.
Yes.
And, you know, I know most of my friends are pre-nursing majors, and the nursing program at UNLV is competitive. Like, they only take 200-something students every year.
Wow.
But, you know, my sister, she goes to school, but not for nursing, and it's nice to learn that there's other fields that someone can go into.
Absolutely.
I did some research on your products. I know you have something called Stratos, Retra, and Avivo.
Yeah.
I know Avivo isn't called Avivo now. What is it called?
It's called Alio.
Alio.
Yes.
Can you tell me about what field of medicine you and your products kind of focus on?
Absolutely. Yeah. So we do upper extremity orthopedics. So that includes stuff like carpal tunnel, joint replacement, joint surgery, anything to do with the hand, elbow, or wrist. And what our products are, and the reason why we changed the name from Avivo to Alio is it's a good business topic for you because I know your degree's in business, or your undergrad, is that there was a company that sent us a letter, a cease and desist letter. And it was like, you can't use that name because they had registered that name, even though we did a search. We had a lawyer do a search, copyright and patent search, and they were like, you're good. But apparently this company came out of nowhere and they've got the rights to that name, so we had to change the name.
So I guess it's just, despite having to look through and do that research, some things are inevitably missed in business, right?
Exactly, and I had to pay for it. So that's the the crux of it. Unfortunately, we're doing well, so it's okay. But if you're just starting out your business, you have to be careful of those kind of things. Don't spend too much money on lawyers and accountants and patent people. Just make sure you run your business effectively and cost effectively.
Okay.
So going back to the products, Stratos, I came up with Stratos because I was kind of frustrated. I started out my career in this, I was 26. It's crazy. It was only a few years ago. And it was an interesting thing. They were doing this procedure called endoscopic carpal tunnel, which is basically using a scope. So the way it started is, back in the 80s, they would do arthroscopy, which means the difference between endoscopy and arthroscopy is within the joint. And what they do is they put fluid in the joint, and then they stick the scope in, and you look around, and you can debride and do all those fun things. And then somebody got the genius idea, why don't we just take the scope and put it in the wrist and look at the carpal tunnel, which is a really good idea. And his name was John Agee, and he was an amazing guy. I actually trained him.
Oh, nice.
Yeah. and in my technique. And he goes, you know, he's like, I like my instrument better, but that clear cannula, Romi, I didn't think of that. And I was like, oh, really? He's like, that's the one thing you got me. And that's kind of cool because he invented it. Anyway, I digress. So yeah, he started it and he was like putting it in, but it was very primitive, metal tubes, and like you go with the metal tubes, scope on one end, instrument on the other, and you're trying to cut the ligament. So the idea is that the carpal tunnel, the roof of the carpal tunnel is the transverse carpal ligament, and below that you've got the median nerve, which is getting compressed, and the flexor tendons, which allow your fingers to do this. And the median nerve gets compressed. You ever fall asleep on your arm and you wake
like
up
and then it's all tingly?
Yeah, people are like that all day long. Yeah, and what can happen? It becomes a debilitating disease and carpal tunnel is a disease. It becomes that way because what happens is the numbness starts, and then if it exacerbates itself and gets worse, you start to get what we call atrophy in the hand, especially in
because you're not using it and it's degrading your hand.
Partially, that is true, but mostly because the nerve, what it does is it flows into the muscle, like your thenar muscle is something called the recurrent motor branch, and it goes in there and it feeds the muscle. It gives the muscle proprioception. You know, gives it awareness where it's at. I was in space. What's it doing? Once that nerve is blocked off, the muscle starts to, like, I don't know where I am. I don't know what I'm doing. And it starts to slowly atrophy. And yeah, and people with severe carpal tunnel, there'll be like a triangle here in your palm and it's sunken in.
Ew.
And so it needs to be taken care of. And it's something that with the endoscopic, it's good, but it's not great. So what I did is I was, like, going back to what I was saying originally, is I was getting frustrated because I was sitting in the OR and I'm like, this is a complicated procedure and it's risky. I want to make it so it's fast, cost effective, and extremely safe with a very rapid recovery. So what I did is I came up with, instead of using a metal tube, we'd use the clear plastic tube. Seems obvious, right? But nobody thought of it. And that tube became our cannula. And then within that cannula, I was like, I want a camera, a light, and a knife, and everything to be inside there. And all being done together, right? Single incision, and my colleagues pointing out, look, this is it. There it is. You know, like visual aids help. So I'm looking over there because I have a view screen. But yeah, so this is the Stratos. And what I did is everything is combined inside. So you've got the clear cannula here. And then what I did was different than the other devices is you can work within the cannula. So the cannula becomes a static cannula. It stays stationary.
So once it's in, you can't accidentally damage like another nerve or anything else apart from
what's in the cannula. Yeah. So you're actually protecting the nerve with the device instead of threatening it, which is what the other ones are doing. That's where the big difference is. So what the cannula does is it goes in, it displaces the tissue and holds all the tissue at bay, and then you work within it. And then once you're ready, you just pull this back and slide this lever over, and there's your blade.
Oh, I'm glad you have a visual demonstration. I don't know if the camera caught me losing it at cannula. So
fair enough. But here, take a look. Ooh. And you know, the interesting thing about it is,
be careful, that thing's sharp.
Yeah, it's very sharp.
Okay, I won't touch it too much then.
Well, the blade's in. You're good. The safety is on.
So with the blade in right now, I can grab the cannula part.
Yeah,
and it's fine.
Yep.
Nice.
And if you look, it's flexible. So if you pull the metal tube out, so rotate the rear housing, and then pull back, and now squeeze the cannula.
Squeeze this part?
Yeah, the clear part. See?
Ah, it is.
It's very flexible. So the idea is I wanted a material that was obviously, you could see through it with the scope, because the scope goes inside there, and you see on the monitor what's going on. So everything's magnified. And I didn't want that, the straw in the glass thing. And you look and you put it in the water, and it's like, what? So I want to make sure it was in real time, because obviously we're working right next to the median nerve. And the median nerve has a recurrent motor branch. It has a branch to the third web space. It has a communicating branch to the ulnar nerve. So there are all these things going on inside there, and you need to see them.
So in layman's terms, if you cut something you're not supposed to, the guy can't move his hand anymore?
Correct.
I see.
Two things. There's sensory nerve and motor nerve. The motor nerve, if you cut that, they can't move their thumb. That's a big problem. Sensory nerve, if you cut like the sensory branch to the third web space, they'll just have numbness here.
I see.
So different lawsuits, different amount of money, and also, different recovery and all that. And they do make something called a nerve tube, which I'm going to have soon. It's a clear tube, and you put each end of the nerve in, and you suture it into the nerve, and it grows within the tube. It's cool. Yeah, and it reattaches. And the way it works is a nerve, if you cut it, it heals 1 millimeter a day until the tip of wherever you cut it to. Pretty cool, right?
Yeah.
Yeah.
So, although not being a doctor, you work with a lot of doctors. Can you tell me, so you do casework, right?
Oh, yeah.
Of course. Can you tell me what it's like to prep the operating room? In my class, we had a big discussion about germs and the spread of germs and the pandemic, or I'll get into that later, but, I want to know specifically what it's like to kind of prep the OR, because I know modern sanitation has become wildly effective compared to, say, 100 years ago, but we still have such rigid, how do I say this?
What do you mean? Like,
We have very strict sanitation rules
now?
during surgery.
Yes.
Can you tell me what that process is like setting up the OR?
Oh, yeah,
And,
absolutely. So,
what you guys are worried about?
yeah. So, I mean, back in the day, the reason why, like, in the Civil War, you saw all those guys getting amputated was infection. So they would get shot with, like, a lead ball, and then they would get infected, and they had no way of knowing that, they get a bone infection. They're like, the doc's like, we got to cut it off. So to prevent that from happening, it's a lot of medicine is preventative. We, first of all, design the room with negative pressure. And what that means is the actual HVAC pulls the air out of the room. It's really interesting. So all ORs are like that. That way you're not pulling in air from outside, right?
I didn't know that. That's really cool, actually.
Yeah, it's really cool. And you feel it. Like when you go in, you feel the negative pressure. And you're like, ooh, this is interesting. So that's the first thing. Especially if you're opening up your own hospital or surgery center, you got to go through all this. And then the FDA regulates all that, as well as the DOH, Department of Health. And they come in and inspect and do all that. But I digress. So what they do is the OR is a negative pressure, and then they have somebody come in there in like a clean suit, and they go in and they clean everything. The walls, the lights, the flooring, everything gets sanitized with the chemicals. And all those chemicals go down a certain specific drain, and those drains are disposed of properly. And, also because there could be blood or, some kind of biology. So that too, depending on the surgeries you're doing. The surgeries we do are extremity surgeries, so they're much easier. We usually put a tourniquet on, and then there's not much blood. So it's really cool. But when they do like abdomen surgery or something like that, ooh, it's bloody because you can't stop. It's pretty gory. And they wear like full like spacesuits, and they have the air thing coming out like a astronaut, and they're like, and they go in there. It's really funny. But we don't do that. So anyway, they go back to cleaning the OR, right? And then all the instruments go through something called an autoclave. An autoclave is basically a really, really high pressure oven, and they steam it. So it's a steam autoclave. And the metal instruments go in there and they cook it for about an hour, hour and a half, and it cooks pretty much 99% of all the bacteria and everything on it. Now, the best thing to do is what we do is we have a disposable. And what that means is we build our instrument, we clean it in a clean room, and then we package it in a clean room, and then we send it out to gamma radiation. And like, the Incredible Hulk?
Yeah.
It's gamma radiated, same thing. And they gamma it in a special room, and we do dosimetry and we do bioburden to make sure it's all done right. It's regulated by the FDA. And and what that does is it gets rid of that 0.1% that we were talking about earlier. It's just that risk. So a lot of hospitals want the disposables because they're at high risk of spreading infection with the sterility of the steam autoclave. So they have lawsuits coming out there, you know what? Yeah. And they're like, if it's disposable, we want it because it takes their liability away.
I see.
So, right. And then the liability falls on us. And that's part of my job, and part of our company is that we go through these certain processes and then get inspected by the FDA and they make sure we're doing everything right. And here's the irony. We tell them what we're doing and then they tell us if it's right or wrong. Like so government. But it's necessary, and I think, it's, I'll do a tangent. I'll come back to what we were talking about. But one of the things that's fascinated me over the 22 years that I've been doing this is that the standard of care throughout the country is the same. It's at a very high level at every facility I've been to. And I've been to every major city in America and the small ones and every major facility. And they all have a very high standard of care and sterility and steps that are taken. It's the only time I've seen regulation actually work. But it's because of the staff. They're all trained well, and they all abide by it, and they're all worried. You know, they don't want to hurt people. They want to help people. So it's really nice. So going back to the rooms, then of course everything's cleaned, and then in the OR when you have a patient in there and they finally wheel the patient in, the reps don't go in right away. What happens is the staff goes in and they drape the room. What that means is they put up drapes around the patient. They're all sterile. These are all prepackaged, gamma radiated. Same thing as my product. They open it up and they put drapes all over the patient, and you're supposed to stand 10 feet away from those drapes. You can't go anywhere near it as a rep. So the doctor then scrubs up, gets cleaned, right, at the sink, and then uses a special soap, gets sterile. I'm sterile. And then goes in.
Put sterile gloves on for them?
Yes. So they drape them. The same thing. So they put the gown on them, which is in a sterile pack. The gloves are in a sterile pack. Everything is sterile. And then they're allowed within that field. But they can't be handed anything from outside that field. So like when we open our package, what we do is we hand it to the circulator, which is usually an OR nurse. And she opens the package in a sterile manner, which means you peel it and drop it onto the table, or you have the doctor pull it from the package. So that way, it's called aseptic technique. And what that means basically is no one's touching, right? Because you're trying to keep the infection rate down. So today, the infection rate is so low.
Yeah,
it still happens.
So all of these procedures are in place, and it's much more complicated than what we see in like movies and
Yes.
TV in order to, make that infection rate so low.
Yes.
And obviously it's pretty successful.
It is. It's very, very effective. It's very effective. And some of it's a little overboard, but it's good. It's good.
Yeah.
I've seen doctors where, a rep will touch the gown by accident, his back, or like the table, and they're like, redrape the whole room. Redrape the whole room. And you're like, oh, God, and they need to redrape the whole room.
Liability is a big thing.
Yeah, it's a big thing, and big thing in business. Liability is everything because, people, we live in a litigious society, right? People sue. But and there's a place for it if you've been hurt, But there's also people who take it overboard. Yeah. Right? Of course, like everything in life, right? And you just have to be, cognizant of that and a little reticent, right? And say, well, how can we take preventative measures to make sure this stuff doesn't happen? Yeah.
So in the U.S. and in a lot of developed nations, we're lucky enough to have those kind of standards set in place regarding sanitation in the OR. But I know one of the doctors you work with, Dr. Colbert, recently went to, Mozambique in Africa, and he did some work there. Are you familiar at all with how it differs in places that are less fortunate regarding the whole procedure of, surgery, endoscopic or otherwise?
Sure. Yeah. In fact, I just went to a fundraising event where they had showed a video or movie that they of what Dr. Colbert and his staff, Kylie and the rest of them are doing over there. And it's pretty amazing. They go over to Mozambique and they basically go there and teach the doctors how to do a higher standard of care. And it's funny, throughout the whole video, Cobra's just saying no all the time to them. He's like, no, do it like this. No, over here. No, let me show you. And he's
like, you can't bring the chips into the OR.
Yeah. No potato chips in the OR. Yeah, and it's cool though. Like he taught him how to do subcuticular sutures, which is like sutures underneath instead of outside, so you don't have a scar. Cool stuff like that. And so get this: in Mozambique, there are 30 million people, and there are 6 plastic surgeons, and 3 of them are practicing. The other 3 are being trained right now for the entire country. Oh, it's absurd.
How are people getting help?
They're not. And that's the real problem. And most of them, so what I learned in the video, which is really interesting, is a lot of burn victims. And I thought it would be from war, right? But it's not. The reason why this burn victim is ridiculous. The infrastructure there is so bad.
I was going to say.
Yeah. They're
infrastructure problems.
They're burning down their houses because they're lighting fires within the house to keep themselves warm and to cook. And they constantly catch fire. It shouldn't laugh, but it's like, geez, it's so rudimentary and so bad there. But what was interesting is that they had these things like, you know what Google Glass is?
No.
So like the glasses you put on and you can see like inside.
Oh, yeah,
like to scroll the internet and all that. So Colbert has something like that. You put the glasses on, it connects to the internet, and the guy in Mozambique has the glasses on, and he can see what he's doing all the way over here.
Oh, so he can...
Yeah, in real time. And they talk, and he's like...
too far to the left.
Yeah, exactly. He's doing surgery, and he's like, no, put the suture there. And he's like, he has a pointer. And he takes the pointer and puts it on the screen. The doc's like, here? And he's like, yeah, right there. And he's like, take this. He has like a thing. He's like, take this section of skin out. Unbelievable.
And is it like accurate? Or is
Very
it like,
accurate. They demonstrated it. I
okay.
even donated some money. So,
Oh.
yeah. It's a good thing. It's a good cause, and it's something that
And it's cool.
is helping people out. It's cool using the technology and using the internet to actually really help people. And they're training more doctors down there. But the standard of care is so low, and there's waiting lines at the hospital, and there's just not enough staff, not enough equipment. Like, you
Not
should have
enough
seen
hospitals.
the hospital. It was ridiculous. The OR was ridiculous. I was like, is it from the 1890?
Mhm.
Like, the OR was empty. Just had a table. and a light that looked like it was from that TV show MASH. I was like, oh my God, it's ridiculous. A little too old for you, that show. But
Yeah. No, over my head.
yeah, old. Everything is old, and they could use help.
Mm.
So it's good that Kolber's doing that. It's a really amazing thing he's doing. They're all doing. Dr. Kolber, the doctors at Cedar Sinai, the staff, they all go. It's amazing. They donate their time. Wonderful people.
Yeah, that's very nice.
Mm-hmm.
Part of our class is talking about global issues. So, I see how the structure in somewhere like Mozambique is so limited compared to where we have. But, the people in Mozambique are still people. Can you
Yes.
tell me, like, what kinds of people are at risk for the upper extremity things that you do? Not just impoverished, low
Sure.
income people, but, people
Sure.
in general, the demographic.
Yeah. So the demographic is for carpal tunnel, which is that's the number one product we have, which is the Stratos, and we sell the most of, which is this guy.
That thing?
Yeah, this thing. Is this guy here? Is women 41 and over.
Mm-hmm.
Usually after pregnancy, carpal tunnel incidence goes up, skyrockets. And carpal tunnel is it's a disease. Most people think it's just because you're typing or whatever.
I was gonna say I play a lot of computer games at home, and I was like, when I was 15, everyone was like, "You're gonna get carpal tunnel," and then in my head I was like, I was 15, I didn't have a big understanding of it, but in my head I was like, okay, if I do less, then it'll go away. I
Right.
assume that's not how it works.
Well, in a way it does, and you're kind of right and kind of wrong. So it's definitely a disease. You're born with it.
Oh, really?
Now, yeah, everyone who gets it is born with it, and it progresses over time. Like I said, pregnancy really exacerbates it and has it come on. The incidents come on quicker.
Because pregnancy is so
It's so
intense on
traumatic.
the body.
Oh my God, yeah. That's why women over 32, like they're considered, or really 32 to 35, it's considered a geriatric pregnancy, which is crazy. But anyway, like the reason why people attribute typing or jackhammering or hammering or whatever to bringing on carpal tunnel is because they've already got it, and then that just speeds up the process.
I see.
Yeah, the trauma, especially
The
car
stress,
accidents.
yeah, the stress is on the body.
Yes. So you did the right thing by slowing down, but you might not even have it. You don't know, right? That's the interesting thing.
Yeah, I didn't know that. I thought it was just something like
No. Everybody attributes it to being, work related because of comp. That's how comp has to pay for it. But it is work related, but originally it's not. It's a disease. It's interesting.
Is arthritis the same thing? Is it something that only some people have, or?
Yes, absolutely. It's a degenerative disease, but again, a disease. It's not an affliction. It's not something that comes on all of a sudden. It's a disease.
I see.
And arthritis is a degenerative disease on the actual joint surface, the cartilage. So that the arthritis comes in and it attacks the cartilage and eats it, and it actually ruins the articular surface of the joint surface, and the joint gets inflamed because the body's trying to heal it, and there's a big battle going on there. That's why you see people with arthritis, they have these huge knuckles because they're all swollen. And then eventually that articular surface or the cartilage wears away, and then they're bone on bone. It's very painful. So we've come up with Alio, and Alio, basically, to tie it back in, is a product. It's a biologic, and what we do is we take the meniscus from the knee, and we take it out of people who've donated their body to science, and it's from a cadaver. And this company, MTF, they strip the DNA out of the meniscus, and the meniscus kind of looks like a kidney-shaped piece of tissue like that, very small. And we cut
Cashew?
it. Yeah, like a cashew, exactly. And we cut it in half, and then we shave it, and then we shape it. So the actual diameter is a little smaller, but also the thickness is definitely less. So we don't displace the joint when it goes in. It's just basically replacing the cartilage that is lost from the arthritis. and it creates a new surface. And people, we actually insert it in the body, right? And it's all sterile, and we suture it into the bone, and then it becomes the new cartilage.
And the body will accept it? Like
Yes.
it won't reject and infect it, or?
No, because it's human tissue.
Oh.
So if it was like, if we were doing something like an implant, then that you get the rejection and the horrible things, and sometimes you have to replace it or put people on medication. But because this is human tissue and the DNA is stripped, the body just is like, yeah, no problem, it's great.
Cool.
So it's very cool and very popular. But we have an issue is that we don't have a lot of them.
A lot of...
Because it's hard, the company gets them from donations, so it's difficult. So it's expensive to process, it's hard to get, and that kind of thing. But I'm actually going down there next week to go see the production, see what they're doing. I know, I'll figure it out. I'll figure out what the problem is. That's part of business. It's part of what
life.
Yeah, life too, but also like that's business. You have major problems, instead of worrying about them, solve them, right? Go head on, get in, and be like, what's really happening here? What is causing this not to work? And let's find a way to make it work. And that's with everything in life, right?
I assume you had to go through that process a lot in developing what it is that you manufacture, huh?
Yes, a lot. There's a lot of trial and error. And it's a lot harder and more expensive to come up with an idea yourself. And then, you have to build it and create it and then test it and go through all that. It's a lot. It's much easier to acquire someone else's, right? Yeah. So that's what we did with Alio is I had the idea, but they were already processing meniscus. So all I did was say, hey, let's shave it. And they were like, yeah, it's a good idea. And then let's put it in the joint, because they were doing this already, but the meniscus was too big.
So
and it wasn't working. It was sliding all over the place. And, and then once we shaved it, one surface, when you shave it, becomes like fibrous and it sticks to the bone. And then you can suture it in. And that made all the difference. It's really cool.
So you developing that product with the meniscus, it's a very good example of like working together with another company. Do you have any plans to extend your company globally?
Look at that, huh? Go ahead, segueing right in, Aaron.
Yes.
Nice. Yeah, actually, I'm thinking in the future of actually doing some kind of private equity or something like that, where they come in and obviously buy the company, a portion of it, and then we can do the entire international market, because they'll have the funding and the networking for that, and they'll have subsidiary companies within that group that can distribute the product all over the world, and companies that will actually be able to help us manufacture too. So it's just a good way to grow the company. It's a good business move. It's kind of it's like a lateral move. You're going from being a standalone business to now being part of a group that can take your company and maybe double or triple what you're doing, which is unbelievable. And then they're going to pay me for it, which is crazy.
It's a little bit out of my realm to understand, but it sounds awesome.
Yeah. Okay. Yeah. It's cool. But that's going back to the global thing, right? Which is your class is about. Excuse me. Is that I can have a broader reach by partnering with other companies, and these companies will have international ties. So when I say, I'm going to make this Stratos, they can say, well, if you can give us a couple of thousand of these or a couple of 100,000, we can distribute them through Germany, Japan, Africa, Indonesia, wherever. And that's where, you start to do more of the global stuff.
Yeah, and take it to other places that really need it.
Yes. Yeah, and make it, and that way it could be affordable too. Because right now it's expensive. And if we can have a broader reach with a larger company that can actually do that, then the price of the unit goes down and the volume goes up.
And it's more accessible.
Yes.
Thanks for telling me about that. There's one more thing that I wanted to ask you about.
Sure.
As we exit out of the COVID-19 pandemic, there's a lot of consequences that we're learning about even now. I just wanted to ask you about how that pandemic affected your business specifically, because I know it was, what's a not curse word for this? It was a very bad show for the healthcare industry as a whole. How did it affect you and your patients?
Yeah, so it's a great question. And, it affected the whole world. It was crazy.
Yeah, of course.
Never seen anything like that. So we were lucky. Healthcare is a kind of the industry that is the last hit by these kind of things. So we had one bad month, the first month, that March. And then after that, it was like slowly climbing back up, meaning our sales. And I was like, how's this possible? And then it dawned on us that everybody's home, but the hospitals are still open. So they're just going and getting the surgery, and the insurance companies were covering it. It's really interesting. So like you're let's just say you're a factory worker, right? And you've got carpal tunnel.
Yeah.
And you're like, I got to work. I got to support my family. COVID-19 hit. Now I'm doing nothing. I might as well get it done. The insurance company's going to pay for it. So that like our numbers went up. It was nuts. It was crazy. But it was difficult in other ways. So I'll give you an example. So when you're a rep for a medical device company, a sales representative, you have to go through certain procedures to get even into the hospital. They have these programs and software that you have to, and you have to test and all. It went through the roof. Like my reps couldn't get in anywhere because of the COVID thing. So they had to all be tested. They had to have the shot or the jab, whatever you want to call it. And, and they got it. And then you had to fill out forms and you had to take tests and, you had to have your history where you were. And then everybody was masking up and like.
Yeah. And it's still that way now. My sister went to go to her OBGYN and they were like, you can't enter without a mask. Yeah. And I was talking to her. I was like, you don't need one. I mean, COVID's over.
Yeah.
And then they rejected her.
Yeah.
I felt kind of bad, but.
You can't even go into Cedars without a mask.
Cedar
Sinai, I'm sorry.
The hospital?
The hospital where Dr. Kober works. Like you can't even walk into their office without a mask on. And it's still like that. It's bizarre. They're correct. You want to slow the spread, especially in a healthcare facility, but it's going to happen. It's a globe. What are we going to do? It's not like we can be off planet. You're going to get COVID-19 no matter what.
Yeah, the discussion about, the spread of diseases is a bit above what I came here to talk about. But,
sure, sorry.
No, it's okay. Was it at all more difficult during the pandemic for patients to be seen and get the carpal tunnel?
Yeah, absolutely.
So was it easier for people who were already diagnosed and just hadn't received the treatment?
No, it was just more difficult because of the restrictions. So everybody had to mask up. A lot of the healthcare providers were getting sick. They were getting COVID.
And then they can't work.
Yeah, like I remember being at Henderson Hospital with Dr. Golshani, and we were doing a carpal tunnel, and everybody there was freaking out because the OR next door had COVID. Like they had a COVID patient, and they were working on him, and we were like, What do you do? It was bizarre. And I think because the pandemic came on so quick that nobody knew what to do. Right? And now there are rules and procedures.
Yeah, we were all in shock.
Yes. Yeah. So it was a learning process for the healthcare industry itself, as well as the world. But, they had to learn like what to do and what not to do and what steps to take. And there were mistakes made for sure.
Yeah.
That's interesting.
That about concludes what I have had prepared for you. Thank you for having me. Do you have any advice for me or my other classmates? You're familiar. I told you about what our class is about, right? The global thing.
Go ahead. Tell me again.
So the class is a part of the honors program at UNLV titled Global Issues. In the beginning of the semester, we learned about kind of this political social ideology called cosmopolitanism, wherein everyone is...
What do you think of that?
What do I think about cosmopolitanism?
Yeah.
I think the biggest critique against cosmopolitanism is that it's too idealistic. But, I think the bigger picture is that if we look past how we think about other people and we look past the superficial things that we can't change about them, we can address the underlying roots of, life's actual issues. And, we had to read a whole book about it. We had a big discussion, and throughout this semester, my understanding of cosmopolitanism has constantly been evolving. But if we take it and we don't critique it so harshly, and we take it for what values it embodies, I see that it just wants people to work together and to live harmoniously as much as we can in a world where it's difficult to do so.
Yeah. Yeah. Excellent. Yeah.
Anyways,
I agree.
That's kind of that's the...
That was a lot for someone your age.
Thank you.
That was great.
That's kind of the hope that our professor and the class, Dr. Michelle Turk, that's kind of the hope as the class ends that she wants us to take forward.
That's great.
So do you have any advice for us?
Yeah. I mean, I think you hit the nail on the head. It's like, there are issues, and you can't as you guys grow and become adults and learn all these things, you can't change the world. But if you can help change your local community or the people around you, or learn how to be a better person and take care of your family and take care of your loved ones, that's the most important thing in life. And if you can do those things, everything else is easier, a lot easier. Mm-hmm. And that's the advice I would give, is just take care of yourself and the people around you, and then worry about the global issues, right? And it's important, because if you do that, you are helping the world, and it's cool.
Yeah, it's like
in your own way, in your small way, right?
It's like a big web.
Yes.
But it really does all start with like you, huh? Or
yes.
me.
Yeah, because that's who you have control over. The ultimate control, right? Over yourself. And then if you can figure that out, then you can help others. But first you got to help yourself, and you got to help the people around you, and then you can spread it out. But I think that's the most important thing. That's something I've learned over the years. Because when I was young, when I was your age, I was idealistic too, and I wanted to change the world and do all these crazy things. But you realize, what's in your capabilities, right? And then maximize those things that you're good at, mm-hmm. and work on them and make them better, and make your life better and make the lives of people around you better. That's the important thing.
That was a very nice message, Mr. Mirza. Well, that concludes what I have. Do you have any other segments you do on this show? Or
Yeah, we do a lot of segments on this show, but usually it's really crazy and funny because we have Dr. Colbert on or somebody like that. And
today it's only Aaron.
But it's good. No, it was good. I mean, I think everything you went over was great, and you did great for your first podcast.
Oh, thank
You're
you.
a natural. So it's really, really good. Now, I want to conclude it, and I want to thank you, Aaron, for coming in and asking me really good questions. You're welcome. Yeah, really good questions. And I want to thank JP for taking the time to do this today. Really appreciate it, buddy. And we're going to end the topic now. And remember to go on the website, check it out, and go on the YouTube and check out more Endo Topics, because there's more coming. Take care.